Hi there. This is the Pennsylvania Clinical Network podcast, where we feature our network's talent and the positive outcomes they yield every day at the PACN. I'm Dr. John Pagan, chair of the PA Clinical Network and your host. It's my pleasure to welcome back Dr. DrRahmanian and his wife, Cheryl, with their successful internal medicine and geriatric practice in Wyomissing, Pennsylvania. Dr. Rahmanian is a longtime member of the PACN with consistently high performance levels. And joining him is his wife, Cheryl. Welcome back to the show.
Thank you.
Thank you.
One of the things that stands out in your practice, and I think you have a fairly good way of approaching it, is the annual wellness visit or the complete office visit in there. And I know that takes some preparation beforehand, the actual visit, and then after to be completely successful there. Are there any tips you want to share on those visits and how to make sure that they are complete and to the biggest benefit of both the patient and the practice?
Sure. I mean, first of all, I must say that we are happy that Medicare finally recognizes that an average geriatric patient needs a yearly physical more than a younger 20 or 30-year-old patient. And they finally made that a reality with full coverage, that they're not responsible, it doesn't go to the deductible, et cetera, et cetera. That has made a huge difference. So they only had the Medicare Welcome to Medicare exam the first 12 months. And before and after that, they had no other option. Now with the annual wellness exam, that option exists. They made it comprehensive, which is good, which basically means both the past medical history and surgical history, the medication review, their physical exam, their psychiatric review, etc., as well as reviewing their wishes as more older patients getting closer to the end of life. They need to review that and consider those options. So advanced living and end of life decisions, etc., are included in that. It is a fairly simple, streamlined process, and the reimbursement for it is attractive enough that I think every physician or every practice should consider doing it on a regular basis. As far as the preparation goes, I'm going to let Cheryl jump in there as what we do ahead of time for it. And we basically, after starting it, came up with a template. Initially, we did some research on what's the best way of doing it, and then came up with a template which we use basically almost like an HMP, but with some additional stuff in there. And the good thing is, first, the good thing is, one, you can couple this with a regular visit. So your regular visit could be a routine follow-up visit or routine blood pressure check, et cetera, or it could be an actual problem visit too at the same time, just like we have with the yearly physical. You find an abnormality, you address that and look into it, et cetera, and you get reimbursed for that in addition to it. But if you are able to do all that stuff and the basic stuff, information gathering, et cetera, can't be done at the time, a nurse, a medical assistant, or some other healthcare individual can address those in person at the time visit or even over the phone, which is a huge time saver for the healthcare provider. And of course, they couldn't do the advanced living. That's something that physician needs to discuss, or the healthcare provider needs to discuss with the patient face-to-face or over the phone, through telehealth, etc. But the other aspects, depression screening, etc., the MA and so on can do. And I'll let Cheryl step in and say what she does for getting prepared for the patient upcoming visit, and then we'll go from there.
Hi. So basically, we keep track of the annual wellnesses in the EMR. There should be somewhere where you can have like a pin note or something, just noting when their last wellness was. And then as they schedule their next appointment, I review that. If they're due for the wellness exam, I'll schedule that for their next appointment. With Medicare, it has to be, I always schedule more than 365 days, just to make sure I don't get caught up or have the wrong date. And then when the patient comes back for their wellness visit, you know, they're scheduled for a regular appointment as well. I'll just tell them, you know, while you're here, we're going to do your wellness to get that out of the way, and you don't have to come back for a special appointment for that. We review the, you know, the patient fills out their depression screening. Prior to that, I will research their chart, update everything that they need. A lot of it is preventative, making sure they're up to date with their mammograms or colonoscopies, their immunizations, smoking history. So I do a lot of that, you know, before they come in. It's all prepared. I like to have my nurse go in before the doctor, do the wellness exam, go over everything, do the BOMC for their memory. And then that way, if they find any deficiencies or any issues, they can discuss that with the doctor before he goes in with the patient. And then that can be addressed at the visit.
Let me jump in there. When she says wellness exam, they're actually not doing exam. Obviously, as a nurse, they don't do exam. But that's
the
what
wellness visit.
The wellness visit. And the BOMC is just the thing that we picked from Medicare approved screening test for cognition, which is a required part of annual wellness. There are other options, but some of the options like clock drawing, etc., is not considered good enough by Medicare. So you have to pick what Medicare says is acceptable for annual wellness. And BOMC, it's a simple thing. Basically, you still remember, you know, 3 different things and so on and so on. We can you can look it up online, and there are other options if you decide to do the different cognition. But with the nurse doing that or someone else, that would save the physician a huge amount of time. And obviously, if there's a deficit where there wasn't one before, or a new finding, you can address that at the time of your visit, as opposed to physician seeing, say physician, it could be any healthcare provider, as opposed to healthcare provider seeing the patient, and then they do the wellness portion, and you find out, oh, I need to address BOMC because they scored poorly and they only remembered 1 out of 3 things, etc. So that way we save time. Sorry, go ahead.
So, you know, the nurse will do all that. She'll review that with the doctor. And then when he goes in for his visit, he can address anything, any problems we might find. He can also address the advanced directives, the living will, durable power of attorney with the patients, and document all that. And then at the end of the visit, we give them a printout of what their preventative care is, you know, when they've had their flu, when they've had their pneumovax, when they had their last mammogram, colonoscopy, you know, they have a printout when they've had all these services done. So they're kept in the loop too.
I was just going to say, just obviously, you know, as most things in life and in medicine, preparation is the key to success, and the preparation you do before and during the visit, even before the physician sees the patient, is key. Are there any key points to the documentation or after the visit to make sure that everything is appropriately recognized?
I do have a template that I created when Medicare came out with the wellness exam. I just basically looked at everything they required and developed a template for that. It's all spelled out.
Yeah, we'll be more than happy to share it with any colleagues at the Medical Society who might be interested in looking at that. That's not a proprietary thing. It's a simple thing anyone can put together, and we'll be happy to share it.
Well, that's great, and you know, I think that sharing aspect is one of the reasons we have you on this podcast, and certainly you as a member of several of our committees share your time and your knowledge too, contracting, credentialing, and group purchasing for the PA Clinical Network, and helping your fellow doctors in doing that as well there. And is there anything you want to highlight about your relationship with the PA Clinical Network? Again, you're such a dedicated leader and member of that. The role of the network with independent practice, how do you see that? How is that evolving? And because I guess independent practice is always evolving as well.
Yes, definitely. There's quite a bit, and but before I jump into that, I just want to emphasize one other thing for my colleagues. Most of us, especially as we go through our career and we get older and spend years after years, we tend to want to have less of a routine stuff. So annual wellness or physical exams, etc., all become routine, and we sort of try to veer off of it. I'd rather see the sick patient and deal with that, right? And just a regular routine physical exam, etc. If you are, whether you are in independent practice or whether you work for someone else, being counter will probably recognize this more, but you got to realize that the practice, the charity side of practice is wonderful, but you got to still pay the bills. So the finance portion makes a hell of a lot more sense. So you got to look at the whole thing too. Now, if you look at the annual wellness and your regular visit, the time you spend for annual wellness is a lot more rewarding than the time you spend for a regular visit. As far as the provider goes, your time, whatever the regular portion visit is still going to get billed as regular portion visit, whether it's 213 routine or 214 complex, a new problem, or 215, the maximal level that you're spending with the patient. That still you can build that. You need to do the wellness on top of it, which you're responsible specifically for the power of attorney portion, advanced living, etc. And yeah, that is a huge part of it. But even if you just do a 213 and an annual wellness, you're looking at probably for Medicare, correct me if I'm wrong, Cheryl, what, $300 reimbursement?
Yeah, it's close to that.
It's close to $300 reimbursement. And all you really is spending is a little extra time on top of your regular visit. And the rest of the time, your staff is doing. And that frees you to see other patients, help other patients. So sorry to put it this way, but it's a no-brainer. Why would you not want to do it? You should have it done on every patient. Frankly, if they would let us do it twice a year, we'll do it twice a year. Because it makes sense, because it does make a difference in these people. You'll be surprised how many times we find things that are, simple and should be in front of your face, but the patients either don't feel comfortable discussing, or doesn't come up, or you through screening you find it, and so there are benefits to it, definitely, as opposed to a focused, problem-directed visit that tends to blur everything else on the sides. So definitely that makes a huge difference. Now, back to your original question, PA Clinical Network is a must. I mean, again, I just can't understand some of my colleagues who, one, don't see the benefit in grouping together and working together, who don't see the benefit to be a part of Pennsylvania Medical Society. Who else is going to speak for you? How are you going to project your opinion into legislature and other ways? Who's going to present you on the community, different communities, be it from your city to your state to the country? The hospital you work for, if you happen to be an employee, doesn't have your best interest in mind. Their bottom line is their dollar bill and how their name is, and they'll throw you under the bus if they have to. And then you really have no one else to represent you. So why would you not want to be a member of Pennsylvania Medical Society? I mean, how can you go through so much schooling, be such an intelligent person, top of the food chain as far as intelligence and smartness and all that stuff goes, and not be able to figure out that I gotta be part of my medical society, so I have a say in it, so I can be represented. So even if you work for an entity like a hospital, become a member. Now, if you don't work for a hospital, great. You have options to band together and be able to get some of the benefits that hospitals have by virtue of their size and finances and so on, that you couldn't get on your own. Unless you're a huge practice of multi-hundred physicians and providers, you're not going to have that kind of power. So why would you not want to join an entity that can represent all of you and make you work together as a clinical network, as essentially as one practice, without having all the headaches of having a zillion partners? It's again, it amazes me that we as physicians sometimes just we're off from the basic things that make a huge difference in our lives. In addition to that, it opens a lot of doors. Opens doors negotiating with insurance companies, opens doors showing our work, how much good we do, and so on and so on. And there's benefits galore in networking together, and like in any other business. So again,
I couldn't have said it better. Yeah, I mean, you said it in your words better than I ever could. Certainly, I've been dedicated
was
to
very
the
happy
advocacy
when-
and the voice
Yeah.
for doctors, and again, you said it perfectly, and we can go on for a while, but that brings us close to the end of our podcast. I do want to let you have any final last words before we wrap up today.
I would like to, more than anything else, thank Pennsylvania Medical Society for coming up with the concept and putting it in place. I know it was a costly endeavor, and it's been a great benefit, and I appreciate it very much. I mean, that's the type of thing that we would expect from our medical society, and I'm very grateful, at least for my part. I hope my colleagues are the same, to have medical society initiate the whole venture and help us in this way. Thank you.
Well, thank you. And that wraps up our conversation for today's show. We really appreciate the time that Cheryl and DrRahmanian spent, and the strong work that your practice does for our fellow PACN physicians and all doctors, as well as your patients. I'm Dr. John Pagan, chair of the PACN and your host. Thank you for tuning in to the latest installment of the PA Clinical Network podcast. Be sure to look for part 1 of the Rahmanian podcast, as well as the others in this series, for helpful tips in optimizing the recognition for your practice for the great care that you provide each of your patients. Thank you, and have a pleasant holiday.